What's up, YouTube? Haven't made any videos in a long time, any guitar videos, and there's a big reason for that, and that's what I wanted to talk about. Um, I've been suffering from ulnar nerve problems for the past 5 years. Now, I was still able to make guitar videos before because it wasn't bothering me that much, and I was kind of able to do some things that conservative treatment, they call it, to work around it. But it's getting to the point where I'm probably going to have surgery and I can't really play guitar anymore. So I want to kind of make a video just real quick um, about cubital tunnel and ulnar nerve problems and some of the things that can aggravate it for you guys that are, out there thinking you have something and similar. I can maybe help. I know it helped me to watch people talk about what they had and what just make you know that you're not alone. It's super frustrating, and I've never been a depressed person in any at any time, but I think I've actually felt what true depression feels like, because it's like, if you love playing guitar or you love working out or anything like that, and all of a sudden you can't do any of those things, it sucks. So I guess misery loves company, but I wanted to invite everybody to talk about issues they're having in the comments section, and I'll give you advice if I can, because I've been dealing with this for a while. But anyway, you know, get get a discussion going, and I know it'll help me, and hopefully it'll help you. But anyway, if you don't know what cubital tunnel is, or if you're kind of thinking you might have it, it basically involves your ulnar nerve, which is your funny bone. So you have three nerves in your arms. One is your median nerve, and that runs down the center of your arm, and that's where people get carpal tunnel. That's a lot easier to fix because you're just decompressing this wrist area. With the ulnar nerve, there's basically two reasons that you can start getting problems. One is the reason I have, and I think I have a mix of both, but my ulnar nerve pops out of the cubital tunnel, which is this kind of space in between these two bones here, and not to get too medical or whatever, but this one's called your medial epicondyle. When I bend my elbow, it pops over the bone, so it's irritated the nerve and it swells up there and it causes numbness in these fingers. And I've had it in my right hand for almost 5 years now, and it's kind of gone to where it's all in these knuckles, and I mean primarily in here, but you can feel it all over your hands sometimes. It doesn't really stay in here like some people say it does. Sometimes you can just get sensations all over your hand of numbness, and I'll get pain in my elbow. And this is obviously my picking hand, so when you're playing, I never used to play sitting down when I first got this. So that's the one thing you can do to help yourselves. Don't play sitting down, especially don't play. Sorry, I'm filming this with my crappy iPad because my camera's not working. But if you're standing up, your hand can be down like this. But if you're sitting down, especially if you have it on if you're on your right knee like this, you're gonna have your elbow up like that, which is in a bad position. So if you're gonna play sitting down, play in the classical stance. So at least that allows your arm to come down like this. Now that only works if it's your right arm. If it's your left arm, you're kind of screwed. So that's where I'm at about now. I had it in my right arm for a good like 3 or 4 years, and I wore these night splints. So basically the doctor will tell you, take anti-inflammatories, don't bend your arm, don't talk on a cell phone, don't hold a book like this, don't do anything that involves your arm being bent like that. So, and especially at night, a lot of people have problems when they sleep at night, they'll sleep like this or whatever. You definitely don't want to do that. You want to keep your arms as straight as possible. I can't sleep on my back. I wish I could. I try all the time, but I try to keep my arms straight. If I'm on my side, I try to like hug a pillow or something like this to keep them straight. These sort of work. Basically, they just open up like this and slide your arm in and strap it in here. Now, I'll tell you one thing. Living in Vegas, these things suck in the summertime because it's like hot, and I don't have to put my air up to like 60 degrees so I can sleep. but it's like wearing thermal, sleeves on your arms. So they can help. Sometimes I wake up, if I wear them too tight, you'll get like a pain in the bottom of your bicep because you're trying to fight it all night and you don't even know it. So I can't wear them all the time because of that. And that's the other reason I don't fasten them too tight, because if you have it too tight, your arm naturally doesn't want to straighten out like this. When you straighten your arm out, you're stretching your bicep out. So it's you're stretching this muscle out all night, and that's why you wake up and it's all sore. So I keep it loose, but the other problem then is that if you don't sleep in one position all night, it sometimes slips off, So to combat the heat of it causing me to get hot, I got this one. And this was a cool idea. I saw and I thought it might be a little more comfortable, and I'll post links online where you guys can check these out on Amazon if you want. But this one kind of slips on like this, and the cool thing about this is that it's open around where your ulnar nerve is. So again, you kind of strap this in, and this causes some of the same problems, and you can fight it at night and wake up with this sore depending on how tight you fasten this. But again, this one has to be even tighter because it's not, the whole thing. So if I find this one comes looser easier, so it feels better when it's on here looser, because if I tighten it too tight, I feel like it's compressing my nerve, like you could have compression there and causing tingling. It's so weird. Like, I know I won't, don't, if you guys have this, know that you're not the only ones. I wear this one night, it helps me. The next night, I feel like it makes my nerves worse. So you never know how it's going to go. But I would give them a try if you haven't, to try to keep your elbows straight. If you guys want to try to do conservative treatment with this, that's probably your best option, is to start with something like this, keeping your arm straight at night. See if that helps. Maybe take like a leave or something like that. Or if you go to the doctor, they might prescribe an anti-inflammatory. I have one right here that's called diclofenac sodium. I don't know if that's the generic or the name brand thing or whatever, but it helped at first. It was actually one of the only ones I took, because they prescribed other stuff for me. They told me to take a leave. None of that stuff did anything. But I took that one, and that actually did obviously mask the pain, but I swear at some point it was getting rid of some of the numbness too. But take that for a little while, wear these straight arm braces at night, see if that helps. Modify the way you do other things too. Like never hold a cell phone or phone like that. I always put an earpiece on. Like I won't answer the phone ever to my face. I'll put it on speaker. I know it could annoy some people, but that's just whatever. I'll make sure I have the earpiece on me all the time. So in addition to that, I also was wearing these carpal tunnel braces too, just to make sure I didn't have that. So, I don't wear them anymore. I don't think I have any of that. It's, I don't get any of that kind of pain or numbness. It's mainly kind of the ulnar thing, but I did have these on, and I mean, you look pretty ridiculous when you have all this stuff on at night. I mean, I look like a freaking cyborg or something. Like, I got all this padding on and trying to sleep. It's not exactly the most comfortable, but if it helps, it's good. That's basically the only thing you can do to try to help it. And like I said, avoid some of the things that cause pain. Like for me, it was typing and mousing. I work, as in marketing, and I'm typing and mousing all day, and I tried to buy one of those keyboards that split, that keep your hands like this and not like that. It didn't really make a difference for me. Mousing in particular was actually the worst thing, because I got it in my right hand first. Doing this, just holding the mouse and kind of moving it back and forth was enough to just aggravate it to no end. I would get numbness, I would get pain in my elbow. I'm sure that, coupled with playing guitar and going to the gym, was, contributing factors. And it's aggravating to think that there's a lot of people that do all of those things and never have a problem, and do them far more than I ever did. I mean, I was never going into the gym and tossing up crazy weights and doing things that were beyond my control, or playing guitar for 7 hours a day. I mean, I work out maybe 3 times a week for an hour, play guitar for maybe an hour a night. And then, you're working all day, but that's it. It's not anything crazy. Sorry, trying to get the pre-workout coffee. And that's one of the things I still do. I still work out. I don't play guitar as much, but I still lift weights. I don't do anything over my head like this. You're really asking for it if you do that. I just started doing it a couple weeks ago because I have an appointment to see the hand surgeon. I'll try to videotape that for you guys so you see what kind of stuff that you can talk about and ask questions about. But I kind of wanted to aggravate it a little bit to see them. I've met with like 6 hand surgeons so far, and they all tell me the same thing. I've had EMG tests and everything where they put these, well, they'll do 2. They'll do a nerve conduction test where they just kind of shock your muscles to test how well it passes through your nerves, and then they'll do another one which they kind of stick needles in and do the same thing. It's not painful. It's not bad. Don't worry about it. I mean, they're not, I thought they were going to poke them right into my nerve or something like that, and I was like freaked out about it, but it's not bad. It's nothing to worry about. So they did that, and it showed that on my right arm, which I've had for, like I said, almost 5 years, it's kind of mildly declined. But they'll say stuff like, well, it's not really bad enough to warrant surgery, but then they'll also tell you right after that having surgery, you can't fix what you damage. You can only prevent it from getting damaged further. So I don't understand that, it's like, hey, let's wait till it's messed up really bad and then we'll do surgery, but sorry, we can't fix it all the way, so it'll just kind of be, a little better, versus doing it when you have a better chance to, recuperate fully and repair what's been damaged and not lose anything further. The best explanation I got was I went to one of the team physicians of the Anaheim Ducks who does all the professional, like Tommy John's baseball surgeries, and he basically said, like, it's not like moving muscles and ligaments around. When you move the nerves, it doesn't take a lot for them to get irritated. And I mean, I guess case in point, if just it rubbing over your bone right here is enough to cause all these pain and problems, what do you think is going to happen when they do the surgery and they move it over here? And that's called transposition surgery, and they can do it either 2 ways. They can do subcutaneous or submuscular. Submuscular, they kind of make a Z cut in your muscle and they put it in the muscle there and kind of put try to secure it under there to make sure nothing hits it on the outside, because it's the only nerve that runs on the outside of your arm. So that's why when you bang your funny bone, you're not actually banging any bone, you're banging your nerve. So it's susceptible to injuries. You can actually get this problem by hitting it on something. And I don't think I got it that way because I got it in my left arm now. I do remember once like banging it real bad in the gym when I was like stretching out on a pullover machine. I just went like that and right into one of the counterweights, which was like a sharp square thing. It hurt like a bitch, but I don't think that was what did it. But you guys know that if you have this or anything like it, you're going to start thinking of all little stuff like that and thinking you banged it into something and like, oh, I swear that's what effed it up. But it's not. It's just genetics, being unlucky. I don't know. But anyway, so there's submuscular transposition and the other one is subcutaneous, and that just means they put it below your skin. That to me seems better because I know I haven't been able to work out a lot. I probably lost 20 pounds since I started having this. So I'm a lot smaller and I just can't work out and do as much volume and build up as much muscle because I can't train as intensely. But I keep thinking, like, if I get this fixed and I don't have pain in my elbow, I'm going to go at it pretty hard again. And what happens when my arm starts swelling up? It could impinge it there. So I figured if it's on the outside or subcutaneously, there's more room for it to expand as long as you're not, in some sort of combat sport or like, doing MMA or football or something like that where you're going to get hit there all the time. It might not be so bad, but I don't know. I'm not a doctor. That's just sort of bro science, I guess. But we'll see what the doctor says. Today's Monday, and it's next Monday, so we'll see. Like I said, I'll try to take a video for you guys. Another thing you can try is foam rolling. Get one of these, try to roll out on the floor like your forearm muscles around here, and sometimes your bicep and your tricep. I tried to do that, just thinking maybe some tightness there caused the numbness, because I've noticed that when I bend my elbow, like if I have to do repeated bending, or when you, I mean, it's like people think, well, don't do that. It's like, I brush my teeth, I shave my head, you eat, you wash your face, anything. You got to bend your elbow to do it. You can't just avoid these things altogether. It's like, yeah, I don't play guitar as much anymore, and when I do, because I have it in my left hand now, I can't even play sitting down. I have to play like, Jimmy Page like with it all down there, which I don't have huge fingers, so it makes it really hard to play a lot of stuff when you have a guitar down there, but something's better than nothing. At least I can play like ZZ Top stuff, Billy Gibbons. But I've noticed that when I bend it is when I get, see, when I did that just now, I get a shooting numbness right here and it feels like a stabbing pain. So sometimes I get more of a stabbing pain with the bending, and I'll get pain right here. The numbness for me comes when I'm doing fine motor movements with my fingers. So when I'm typing, and it doesn't even have to be repetitive like this. Like if I'm writing something down, or I'm, messing with a phone. And whenever I'm messing with my phone, I usually have it down in my lap, It's because I'm not holding it up like this. It's just, you have to get really conscious about where your arms are bending, and you'll start to get that way when you start having pain every time you bend them. But the point is to then keep, make a conscious effort to keep them straight in a lot of the things you do, and hopefully that'll help you. Same thing with typing. They tell you like ergonomically, you're supposed to, be seated here like this or something. That's bullcrap. Like if you have carpal tunnel, maybe that's good, but like for this, you want to try to keep your arms as straight as possible. So I used to sit on like an exercise ball, and I got back here, and it would keep me up higher, and I would have my hands down here, and I would be typing like that. And that helps a little bit, but again, you get to a certain point where I don't think conservative treatment only takes you so far. I think it just delays the inevitable. I think I'll probably have to have surgery. I think that's what I'm going to hear. I've like I said, I've been to like 5 or 6 surgeons, and they've said, no, not yet. But it's not getting any better. So what's the point of waiting? I mean, I don't understand it. It's not going to get any better. I mean, there's another guy on YouTube, Wyatt Cup. I'll link his page in the below, because watching his is what motivated me to make this video. I mean, he had all the same things that I do. He liked to, lift weights. He liked to play guitar. And I mean, it sucks for him. He was younger than me. I'm 37, and he's only like 18 or something like that. But I guess on a good side, if you're going to have this problem, it's good to have it early, and then you can fix it and then get on with your life, especially in terms of lifting weights. Gains will come back a lot faster if you're younger versus an old man like me. But so yeah, check that out. He shows his recovery after surgery and everything else, and it really felt good to see somebody with like the same thing, like plays guitar, lifts weights, understands how bad things suck when you can't do the things you like. I mean, it's like being stressed out about something, and then people tell you to we'll do something that relieves stress. It's like, well, okay, I play guitar, that relieves stress, I can't do that anymore. I'll go work out, or I'll go do something active. Well, no, I can't do that anymore. What can I do? Well, I can sit here and just sit on the couch and do nothing. So that doesn't really work. So I'm hoping that I can get the surgery and I don't have any problems with it. I'm just going to keep working out all the way up until it, because, what the hell? I don't think it's, I look at it this way. The bending is bad, but when you're in the gym, you're only doing it for, a half hour, 40 minutes. It's not that bad, and if it helps me keep my sanity and keep a positive attitude and outlook, then it's totally worth it. Like I said, I don't do anything overhead. I try not to do anything like that. I break it down to just 3 days a week. I've done a couple different things. I've done like an upper body and then lower body day when it's really bad, just doing 2 days a week, and then just doing cardio and stuff in between. But right now I'm doing like chest and arms, and then I'll take a day off and do back and shoulders, and then take a day off and do legs, and then take the weekend off and then start it over again. So today's probably the day that irritates it the most, chest and arms, because there's a lot of bending and whatnot in your arms. So back and shoulders aren't too bad. As long as you don't, when you're rowing and doing stuff, don't pull back so far. And for all you guys that play guitar and stuff too, I think you could benefit from going to the gym as well. It's not going to inhibit being able to play fast and stuff like that. If anything, it'll, because you can't play guitar because of this, it'll give you some sort of outlet. Or just like I said, play the guitar hanging down low, you know, and just watch it. Don't bend your wrists a lot like that. If you're doing complicated chords, you're not going to be able to do that stuff with it hanging down like that. You're just going to be able to do bluesy stuff, you know, like you're not going to play any Steve Vai virtuoso stuff unless you have like huge fingers. Then maybe you can reach around, but I don't know. So anyway, I hope that helps you guys. And that was a lot of rambling and whatnot, and I got some extra caffeine boost here because I'm almost ready to hit the gym. It actually just stopped raining, so it's perfect timing. But yeah, that's about it. Let me see if I thought. Oh, one more thing. Here's another helpful device. This is a mouse that I use, and I got it because having your arm extended like this, and whether your elbow's on the table or you're doing the mousing, it just gets uncomfortable. I know because I've been dealing with this for 5 years. I've been working a full-time job as a marketer, so you know, do yourself a favor, check one of these out on Amazon. It can be frustrating. That's why I got the corded one. It seems to work better than the Bluetooth. I also have the Bluetooth. But basically, you use the trackball for the mouse, and then I don't really use these buttons here, but I think you can program them. And then you have a scroll wheel, and you can actually click the scroll wheel to bring up like menus on the back. And then your mouse click is this. So it's pretty cool. Like my computer just turned on now, so it helps a lot. I first started using it, and then you can keep it in your lap. You know, you can basically be standing there and, you know, be on the computer like this. So it helps out quite a bit. Try that out. See if that helps. And the key also with this is you can keep your hands in your lap and not have to put them on the desk. Typing, on the other hand, the solution for that is not so fun. For PC, I use Dragon. Get yourself one of those. I think it comes with the headset like this. It actually works pretty good for PC. I mean, take it from somebody who worked a office job. I was pretty much able to do everything. It's frustrating if you're not. I mean, for composing emails, texting like that, it's fine. Even in PowerPoint, it can be okay. But if you have to start working in Excel or something like that, you're probably gonna have to type. But at least you're limiting the time that you're typing. So those are probably all the best conservative things you can do. Past that, it's, surgery. There's not really anything else you can do. I mean, taking the anti-inflammatories only works for so long. It only masks the pain for so long. But then, you feel better, and then you go overdo it, or I play more guitar, or I go to the gym, and it just it doesn't get any better, or it comes back real bad and reminds you that it's there. And again, if you have it in one arm, be careful what you do in the other arm too, because you can get it in both arms, and the doctors have told me that it's common. I mean, it just makes sense. If you're susceptible to getting this, you'd be susceptible in the other arm to it as well. I mean, it's just one of those things where some people get like, I must be somebody who gets these repetitive stress injuries, because I used to have tendonitis in my knees from playing basketball, and I wasn't playing any more than anybody else, but you just get them, and it is what it is. So you gotta, either work around it or try to be careful, or just stop that activity and do something else. But I hear you guys, and I hear your frustration, because with this kind of stuff, you can't stop bending your arm. You gotta feed yourself. You gotta wash yourself. You gotta brush your teeth. No one wants to smell your stanky ass breath if you didn't. So anyway, I hope that helps. Guys, leave some comments below and just talk about what you've got. You know, if you think you have this, I would recommend you go to the doctor and get checked out. And then just try some of the things, you know, and if you don't have health insurance or something like that, try some of the, you know, things I talked about, like the braces and keeping your arms straight at night, see if that helps, and maybe take some leave or something like that, and no overhead stuff at the gym. You know, instead of tricep extensions, do something else, man. It's, you know, it's not like the only thing you can do, and, you know, you don't have to do overhead presses for shoulders, just do front raises and side raises and stuff. But I hear you. I totally hear you. It sucks ass, and there's no two ways about it. But it feels better knowing that there's a lot of people out there that are dealing with this. You'd think they'd figure out a way to fix it, but I just don't think people give a shit. You know, like the doctors don't give a shit, I guess I should say, because, you know, there's no money in fixing it. We have to pay money to get surgery, and, you know, I don't know. I do research on this. I've researched trying to find so many different studies, and they all seem to be old ones, you know, like 2009 or 2005 or whatever. But it's the same surgery they've been doing for a while. You'd think they'd come up with something better, maybe, but they don't. And then, just so you know, there is a compression surgery they do for a cubital tunnel as well, if you have a compression here. And that's what I think. I kind of have some of that too when I have to move my fingers. I think that's the compression, because I can have my arm straight and still have problems. So I can play guitar with my arm hanging down real low like that and still get numbness in my hand. Just because I think, one, my nerve is irritated. So anytime you use your pinky and ring finger, you're activating that nerve, because your ulnar nerve controls this finger and then half of this finger. So your median does the rest, and then your radial does the back side of your thumb and your hand here. And I have sensitive nerves. I don't know why. That's what they told me. And I've banged, or not even banged. I've rubbed this against, like, let's say I was holding something, it just rubbed like that. I'll get tingling on the back of my thumb and stuff like this for no reason. I don't know. Maybe it's because I'm skinny and it just hits it or something. But I mean, I can tap on the back where my elbow is, right here where my ulnar nerve is, and get tingling and paralysis in my hand. So, you know, for you guys that have the same thing, I feel your pain, but do yourself a favor, and if you don't want to have surgery, try to modify the things you're doing and keep your arm as straight as possible, as much as possible, and don't type, don't mouse, or doing that stuff. Get dragging. Again, the PC one works good. The Mac one sucks ass, I've heard. I haven't tried it yet, but it's like, I don't know, it's $100 some for the Mac one, and I don't want to buy it if it's crap. I got the like older model for the PC, and it wasn't that expensive, so, you know, check it out. But anyway, I'll put up some more videos when I have my appointment at the hand surgeon, and I'll let you guys know how it goes. I even plan on filming the pre-surgery and post thing to really give you guys like a day-by-day view into, you know, what it's going to be like if you had this, because I'll get to do both. So if I forget to do it on my first arm, I can do it on the second one, because I'm sure I'll probably do the right one first, because it's worse than the left, even though the left gets tingling and numb just as much. I figure the right one's been bothering me more, or bothering me longer, so it's probably best to fix that one first. But once I get it fixed, I'll have to do everything with this arm, so it's probably going to get worse quicker, and I'll probably have to just get that done. So, you know, I'll probably be out of work for who knows how long, and I don't think I can get disability for this in Nevada. That's the other thing that sucks. Is like, you know, you can't get disability for this kind of thing. Like, not that I want to be on that stuff, but it would be nice to help pay my bills while I can't work or do anything because of it. But like, they'll say, oh, you know, you should be a security guard. You could go do that. You don't have to type. It's like, well, first of all, I'm like 5'9", 160 pounds. What kind of security guard am I going to be, you know? And then the other thing is, like, driving even irritates it, you know? Like, I don't drive a lot. Like, my wife does most of the driving when we go around places, and, you know, I'm going to drive to the gym now, and I'll drive to go get groceries and go do errands and stuff, but I'm not doing a lot of driving. When I was commuting every day, like 35 miles each way to work, it was a bitch. I had to carpool with my boss, and he pretty much did all the driving because I couldn't do it. And that's when I stopped typing. I stopped doing all that stuff because it's just every little thing adds up. You're typing all day. You get home, you get in your car, you drive home. You're bending your arms all the way there. You get there, you eat. You do. Oh, I want to play guitar because I want to chill out, and then you got your arms bent again. It's so limiting because you can't do any of those things. So I don't know why it's so hard for people to get disability when they have that. I mean, I had a friend who had these kind of symptoms, and then it wound up being thoracic outlet syndrome. So you guys have to watch out for that, because if you have the same symptoms, go to the doctor, get checked out, because mine are definitely in my elbow, but they done back x-rays. I've had cervical spine MRI. I've had MRIs on my elbow, and they do that because they want to make sure it's not getting pinched somewhere up in your shoulder, which could be thoracic outlet syndrome. And I had a friend who had that, and he was really worse off. He actually worked with my wife and did a lot of typing as well on an office job, and he couldn't do any of that. And he had to fight pretty hard to get disability. And I mean, he's real bad off now. He has to use like a mouse that he wears, like glasses, and just kind of use your eye and stuff. So it's tough for him. So as bad as cubital tunnel is, I guess thoracic outlet syndrome is even worse. So I'm pretty sure I don't have that, but if you guys have these symptoms, try to figure out if you ever feel numbness up in here. I think that's a sign that it can be like or numbness above your elbow. I think that can be a sign that it's thoracic outlet syndrome and not cubital tunnel. So good luck to you guys. Again, I'll film some more videos, and leave some comments below and let me know what's going on with you guys, and we can kind of help each other through this stuff. So hope everyone finds this helpful, and good luck to everybody. Aloha.